Welcome back to Minges Chiropractic. I'm Dr. Gordon, and welcome to our Wellness Spotlight series. I'm here with Tonya Rocho. Tonya is with Rock Solid Studio in Battle Creek. Tonya, I was trying to remember when we met. I know it was at least 7 or 8 years ago, and I know it was from some recommendations that I had from patients who were going to see you already. And I'm really glad that you're here. This Spotlight series is all about recognizing and highlighting some of the professionals that I've had a chance to meet in Battle Creek who I know they're doing good work, and you do fantastic work.
Thank you.
If you've ever heard a recommendation for Tonya's work and her ability to train with her clients, the impact you have on your clients is really impressive. So thank you for your time. Thanks for being here. What I would like to start with, the question that I had to start with you is, what is your initial visit like with a potential client? So when someone comes to you and they have specific questions about personal trainings or wellness, how does that look? How does that typically go?
So when I first meet with a client, I'm trying to gather information on medical background, surgeries, past sports maybe.
Okay.
Any type of information that gives me a direction on what kind of knowledge they have about exercise and movement patterns. But also too, when I'm meeting with a client, to get them to understand that exercise is not necessarily the best place to start based off their history or current situation.
Okay.
You know, there's other things that we need to do to get started. And there's corrective exercise, or trying to get a person to connect with their bodies. It's amazing how many people don't know what their body feels like, and so trying to get that into place, and then we start moving into exercise, which is my favorite part to teach.
I'm sure it is. Well, and I can imagine that might be an obstacle at first, because most people probably want to get right to the exercise part first, right?
Well, they get online and they start Googling.
Yeah.
And everything is, you do better when you have exercise. Well, absolutely. But do you know how to exercise, and do you know how to exercise for what you're really trying to achieve? And is it even suitable for your body?
Right.
We all have our own limitations and challenges and stuff like that. And people don't take in their family life, their work life, and all the stress, and how that has the physical effect on the body. And then what type of exercise is appropriate. Some just think they have to go in and just start moving, and that's where injuries come in, lack of results come in. And so when you're working really hard and you're not getting anywhere, there's a problem.
Yeah. And you mentioned the injury part, and I've seen that here in our office. We'll have someone who is hurt. They've got neck pain, low back pain, maybe a history of some chronic issues. They're trying to get well here with the chiropractic care, and then they start asking, well, what do I need to stay healthy? And it's really hard for me to know that in the moment. And I know they want to just get to a gym and hop on an elliptical for 60 minutes, and then they feel like that's going to be everything they need to get strong and well. And very infrequently is that all they need to do. It might help a little bit, but there's other things involved too.
Right.
Yeah. Now, what is a typical client for you? What do they look like?
Believe it or not, it is more of, I would say, the aging population. So I would say probably the 50s and older.
Okay.
Also those who have a lot of pain that they experience, and whether it's from an injury or a surgery, or maybe nobody knows why they hurt when they move. And so that's kind of my little specialty is, I'm an integrative movement specialist. So when they come to me with pain and they've been through all the testing and they've been to the chiropractor and they still have all this pain, we're looking for muscular imbalances. And that's maybe where we need to start is let's find these imbalances, and let's find out which ones are overactive and underactive, and let's bring them back together. And then we can start moving the body in the right movement patterns that's most optimal for that person.
That's great. That's great. And I imagine the history that you take with your clients is really important for that, because like you said, you look into surgeries they've had. You look into past injuries. Like, did you have a rollover accident when you're 20 and now you're 60 and you have shoulder pain? Well, how might that be connected?
Right.
A lot of trainers are not going to do that.
No.
And I know for sure that one of the reasons your clients appreciate you so much is because you are so thorough, and you do such a good job of really trying to understand not just, okay, I want to be stronger, but the whole person.
The person. I take a lot into the person. I really get to know the client. And the more I know about that client, the better I can train them and get them to understand more about their bodies and everything.
Great. So outside of strength training, what else do you focus on?
Outside of the strength training is their mindful connection to the body and what they feel.
Okay.
So a lot of people don't know how to turn on the appropriate muscles, and so trying to get those back on board, that's actually really fun too. That actually is more fun than sometimes the exercise, because when a client can feel what I'm explaining, and the cueing is important.
Okay.
Every individual's different, so my treatment plan for one person may not, you may come in with two people with knee problems, but I'm going to treat this one very different than this one.
Yeah.
And it's all in the way the person connects. And so my cueing might be different, the exercises may be different, but we'll get the same result in the end. You know, they're going to be better. And then obviously I always recommend, if you don't have one, you need one, is a chiropractor on your team.
We appreciate
because
that.
we go hand in hand.
Yeah, absolutely. Yeah.
If your skeletal system is not in place for like the way it's supposed to be, and your spine is not functioning the way it's supposed to be, it's going to be much harder for me to do my job.
Yep.
And so, and then it's going to be harder for the client to feel what they're supposed to feel.
Absolutely.
So we work together very closely.
Yeah, for sure. And I know you talk about nutrition, and
do.
it's for the same reason that I talk about, hey, you got to make sure you're exercising healthy. You got to make sure you have the right foods, because if the inflammation levels are off,
Exactly.
it doesn't matter what you do in the gym. You can't outrun your fork,
That's,
so to speak.
that's very true. Very
Yeah.
true. Yes, yes.
Yeah.
And I do try to make sure that everything that I do, that I don't overwhelm an individual, because their lives are already overwhelmed.
Good point.
And so
Yep.
we try to bring balance and try to make the changes that a client feels very good that they can change, because they're going to feel so good when they do make that change. Not just in the fact that they feel different in their bodies, but they actually feel like they are accomplishing something.
Great.
They
Yep.
feel very successful in their own wellness program that they're trying to show up for.
Great. So you give them those little successes.
I do.
Initially. That's great. Okay. So we're gonna cut this short now, because I know we can go further.
Yes, we can.
We'll have you back. I hope you'd come back sometime again
Please.
soon. Thank you for everything you do. I know your clients love you. They respect your opinion on things, and you're a really good resource for the community. So keep it up. Thank you for your time. Thanks for watching, and we'll have more of these. So we'll see you next time.